So, friends, today we are on another revision lecture, another very important topic as far as the examination is concerned. Also, practically, also one very important disease as far as occupational health is concerned, that is pneumoconiosis. So, please listen carefully to this lecture because this comes so often in the exams. Pneumos is lung and conios is dust. So basically, it is diseases caused by dust. And I'll try and explain to you as to why dust causes problem. If you remember this particular lecture, you will realize how dust is creating a problem not only in occupational setting, but dust is creating a problem whether in number of places where there is air pollution, where we have, like for example in Delhi, the pollutants are so high. The particulate PM5 or PM10 or PM2 or 2.5, which has been mentioned. PM means particulate matter. 2.5 microns, 5 microns, or 10 microns. Why are these important? Why are these things important? We'll talk about it. Okay. So it's a group of lung diseases caused by inhalation of dust in the occupational setting. Gradually cripples the worker by reducing his work capacity, causes lung fibrosis and other complications. By convention involves lung parenchymal disease, so it excludes bronchitis, asthma and cancers. There are many of the diseases, many of the dusts which can cause asthma or bronchitis. So these are excluded, and per se it also excludes cancers. We have asbestos which can cause cancer, mesothelioma. It can cause a mesothelioma, but it will not be counted as a pneumoconiosis. Non-neoplastic lung reaction takes place, and this can include diseases induced by organic and inorganic particulate matter. So we'll talk about these, which are the ones we can have: silica, coal, asbestos, tin, iron, lots of them which are there. So we can divide these based on causative organism, that is silicosis, or due to which occupation is there. That means knife grinders or something like that, or you have people working in miners disease. So in the similar way, miners disease or pneumoconiosis, or you have due to coal dust, that is anthracosis. Yeah. Okay. The normal protective mechanism of the body does not permit dust to get into the alveoli. But we have to look at what are the protective mechanisms. The protective mechanism is, first you got the mucociliary apparatus which is there, which in your nose, etc., which prevents anything which is above 10 microns. And this 10 microns particles which are there are through the mucociliary accelerator are brought down and they are removed. Very small particles behave like gas and are exhaled. But what is it that we are really very keen on? We are keen on anything which is below 5 or actually below 3 microns particles, and these will some of these will go into the bronchus and the bronchioles, and less than 2 microns will then get into your alveolar spaces, and then they may be taken up by the macrophages. But the macrophages can take up only so much and not anymore. Once these get loaded so much that they cannot handle it, that's the time when the deposition takes place, and that's the time when the problems start occurring. So here we are, what I was talking to you about. 5 to 10 microns you're looking at upper respiratory tract, you've got the mucociliary accelerator, it brings it out, it tries to bring it out. 3 to 5 microns, it goes into the bronchuses and bronchial spaces which are there, the mid respiratory tract. And 1 to 3 microns which are there, they go into your alveoli, and that is the place where the maximum harm is done. Also, it depends on the amount of the dust which is involved. Like you, when you're going on the road, you also get dust, you inhale dust, but you don't suffer from pneumoconiosis because it depends on the amount of dust which is there. The amount of dust depends on the concentration, on the duration, and the clearance mechanisms which are there. And you will find that also some of the dust which are soluble, while others are not soluble. Also, if your lung is already affected, you got tuberculosis, or you're a smoker, this will additionally affect the problems which are there in the lung, and that is the reason why smokers or people with tuberculosis are likely to get more problems. As I already mentioned, solubility and cytotoxicity of the particle is very important, and larger non-soluble ones which are there, which persist in the lung parenchyma, are the ones which will cause pneumoconiosis. And some dusts which are there, they will cause physical damage, like for example asbestos. You'll have needles which are there, and asbestos needles can cause physical damage to the parenchymal tissue, and then that can cause a reactogenic reaction, and you will find that your person may go into a cancer or mesothelioma. Okay. The physico-chemical reactivity which is there in some cases also, which we will also talk about. Basically, what happens? There is a reaction of the body which trigger macrophages. There is a release of the chemical mediators, TNF and IL-1 or the PDGF. All these things are released, and you have a reaction which is taking place. And this reaction is the one which really causes the fibrosis. Persistent release of these factors will result in fibrosis. The migrating macrophages will go to the lymphatics. Macrophages will they'll be laden with dust, and they'll go to the lymphatics. And so you will find wherever the lymphatics, the lymph nodes also will get involved, will get loaded. So fibrosis will be initially, you will find the fibrosis which is there has some typical relationship. Some with silica is nodular, while asbestos is interstitial fibrosis. So these sort of things do take place, but as it progresses, it becomes a massive fibrosis which is there. So pathogenesis, we are aware, inhalation which takes place, escapes, remove. You have got epithelium which tries to get it out. There may be direct injury. There will be fibrosis. There will be engulfment by the macrophages, lymphatics, as we already mentioned this. Okay, this is an important slide which you will have to mention in your exam. This particular portion is very important, and we give marks based on how many you mention. You can mention much more than this. These are only the very minimal which I will expect every one of you to mention. That is, coal dust causes anthracosis, silica causes silicosis, asbestos causes asbestosis, iron causes siderosis. And vegetable dust, you have cane fiber, which is called bagasse, so bagasosis. Cotton dust or bisonosis causes bisonosis. Tobacco causes tobaccosis. And hay or grain dust will cause farmer's lung. Please remember this slide and vomit it out in the exam if it is possible. This is the complete list which we have of various diseases which can be caused. Silica causing Kaplan syndrome, asbestos causing pleural plaques, also causing Kaplan syndrome, mesothelioma, carcinoma of the lung, larynx, stomach, colon. Beryllium causing acute berylliosis, beryllium granulomatosis and bronchogenic carcinoma, barium causing baretosis, tin causing stenosis, So you got so many others which are there. And the organic ones, other than what farmer's lung, which I mentioned, or bagasse, which I mentioned, you can have bird droppings, which can cause bird breeder's lung. And cotton, etc., cotton, flex, hemp can cause bisonosis, while red cedar dust can cause asthma. In the chemical fumes and vapors, you have nitrous oxide, sulfur dioxide, ammonia, benzene, and insecticides, which can cause a lot of problems like bronchitis, asthma, pulmonary edema, acute respiratory distress syndrome, or mucosal injury and fulminant poisoning. So, what is coal workers pneumoconius? A very common question which comes. Coal workers pneumoconius is associated with the coal mining industry. Basically, when they're digging up, they were digging for coal, but then silica is also there, so carbon and silica is involved, and you can have the classification which is done normally is either it's asymptomatic or is a simple coal workers pneumoconiosis or a complicated one, or in another way it is called asymptomatic anthracosis, simple coal workers pneumoconiosis, and progressive massive fibrosis. Basically, there's gross streaks of coal tissue, coal anthracotic pigment in lymphatics, and I told you the macrophages will grab this coal dust which is there and take it to the lymphatics. So there is deposition of all this in the lymphatics in the hilar lymph nodes, and the carbon pigment will be present over there. You will be able to see it in the hilus. In gross, you will find coal macules 1 to 2 millimeters and coal nodules in upper and upper zones of the upper lobes and the upper zones of the lower lobes. Because it's small particles, it rises. So carbon-laden macrophages and delicate collagen fibers. Now, coal workers pneumoconiosis is very, very strongly associated with tuberculosis. So you will find this tuberculosis and coal workers pneumoconiosis both affecting the upper lobes. So you will find this dust being present. So these are, you can see how the macrophages are laden with coal. And complicated coal workers pneumoconiosis, when you have these nodules which are there, they coalesce, and you have dark scars being formed, dense collagen and carbon pigment being present. And once they coalesce, you may have, because there's not sufficient oxygenation which takes place, central necrosis may take place. So this is how you can see in gross. Clinical course, usually the problem is that they are generally asymptomatic. When there's a little decrease in the lung function, they are asymptomatic. Only when there's progressive massive fibrosis and there's restrictive movement of the lung, then people start coming in with cough and other features and breathlessness. And then by the time then they suffer from pulmonary hypertension and cor pulmonale. Now, what will happen? You remove the person from exposure, but still inside the lung, the patient has still got the coal. You can't take it out. So it is very important that we try and do a normal periodic medical examination and try to remove the person early, or give features by which the dust is not inhaled. Kaplan syndrome is a combination of coal workers pneumoconiosis and rheumatoid arthritis. So this both together is what we call Kaplan syndrome. There's necrosis surrounded by fibroblasts, monocytes, and collagen, and the lung symptoms with rheumatoid arthritis. Let's look at silica. Silica dust, which is there, is basically quartz, sand, rock, crystal, flint, jasper, and opal. High quality silica is important. You use it everywhere. You're using it in chips, and you use silica in construction. So everywhere you have silica. Whether we use it in glass, whether you use it in construction, whether we use it in chips. So it is there everywhere. Results in nodular fibrosis with exposure for 20 to 40. Long exposure is required for this. So where is it present? Wherever you have people who are working with silica or dust or sand. So whether it be in the construction industry or the sandblasting industry or in the mines or stone cutting, polishing of metals, ceramic manufacture, all these places you have got this acute cirrhosis following massive exposure is very, very rare. There's fibrogenic activity which occurs, and these particles, again, as I said, every time the particles, when they come into the alveoli, they'll be taken up by the macrophages, and once the macrophages are so highly laden they cannot possibly reach the lymphatics, they get killed. There's a fibrogenic reaction which takes place. So whatever silica is then released is again ingested. Again there's a cycle which is there. So you will find that lymphatics are involved, lymphs are involved, as in anthracosis, the same story here. Here you'll have discrete pale to black nodules because you may have black because of coal or black otherwise also. Upper zones of the lung again. Fibrosis in the hilar lymph nodes, as I told you, they come to the node lymph nodes, and large fibrotic lymph nodes with peripheral calcification. Here we have got what is called a typical egg shell calcification, because there is a complete area gets this particular, when once the silica gets deposited in one particular area, and the surrounding area you've got a little extra deposition of silica which is there, which gives an eggshell appearance, and the central portion then starts getting necrosed, and you've got a typical formation of an eggshell. Progressive massive fibrosis occurs here also, and basically in microscopy you find hyalinized collagen, concentric. You got a very typical concentric formation which is there. Here you can see this. The X-ray shows fine nodularity in the upper zones and eggshell calcification in the hyaline lymph nodes. Progressive disease even after exposure is stopped, because again it cannot be removed. So we must do periodic examination, which include an X-ray examination and pulmonary function tests. When very commonly associated with tuberculosis, and because decreased cell-mediated immunity, very less this chance of carcinogenic. Basically in silica we do find mostly it is silicotuberculosis. Prevention, basically we'll talk about it: air handling equipment and use of face masks. Now asbestos I could have gone into very great details, but I have cut it short for this particular lecture. And asbestos, you again get fibrous flakes. Asbestos is in form of needle type. It's different types there. We've got chrysodile and anthrophile, and the various types of asbestos. I'll not go into the details of it. You can read up if you are interested. But what is important is these cause physical damage to the lungs, and because of the physical damage there is fibrous flakes which form, focal and diffuse, and may result in pleural effusion. So there's normally in asbestos there's parenchymal interstitial fibrosis, and because of the physical damage you have malignant mesothelioma, lung carcinoma which can take place. If these get carried, these asbestos fibers get carried to other places, then you may have malignancies in the larynx or colon. Asbestos is unquenchable, is resistant to physical and chemical destruction, and therefore it's used for fireproofing, insulation, brake lining, everything, all these places, constructions, ship demolition. Oh yeah, we have got the things like serpentine and amphibole, two types. So serpentine and amphibole. Serpentine, you've got chrysotile. While amphibole, you've got actinolite, amosite, anthopholite, crocodilite, richterite, and tremolite. Just have to remember that there are two types, serpentine and amphibole. If you can remember the rest of it, very good. So serpentine ones are serpentine in nature, so they're curly. Amphibole ones are straight. So if they are curly in nature, the chances of them causing more damage is less. If it is pointed, it can cause more damage, so more pathogenic is the amphibole ones. So both are fibrogenic in nature, but less in serpentine cases, little less. Since it is serpentine in nature, curled in nature, the chances of it getting removed from the upper respiratory tract is higher. And since the amphibole ones are straight, they penetrate further. Okay, so the amphibole ones are the ones which are related, which since they're pointed, they cause physical damage and can cause mesothelioma. So fibrogenic potential is there, tumor initiator and promoter is there, absorption. Basically, it causes a diffuse pulmonary interstitial fibrosis and begins in the lower lobes. Please remember anthracosis, silicosis in the upper lobe, and we have asbestosis in the lower lobes. Honeycomb lungs and pleural plaques can be formed. You can see this, all these very typically which are there. Interstitial fibrosis around respiratory bronchioles and alveolar ducts involves adjacent alveoli. Asbestos bodies, golden brown fusiform or beaded rods with translucent center. Trapping and narrowing of pulmonary arteries is a later problem. You can see the asbestos needle over there. Here you can see how asbestos is creating problems. All you need is asbestos can be found. So dyspnea is there, cough with sputum, may progress to respiratory failure or carpal and cancer. So if you look at the difference between coal, silica and asbestos, you find that basically what we are looking at is macrophages will take up this foreign body as far as possible, but you will find that the macrophages will harm will get killed by in case of asbestos because of their physical nature and may even damage the lung, while in cases of coal and silica they get loaded and they are carried to the lymphatics. In case of asbestos, once this needle type thing goes into a macrophage, it then forms into what we call an asbestos body. And in asbestos, we have got lower portion of the lung involved, while in case of coal and silica, it is the upper portion of the lung. So let's just jump now into the others. Bisonosis, that is cotton fiber, causes chronic cough, progressive dyspnea, and chronic bronchitis and emphysema. And bisonosis, since India is famous for cotton, we have a large number of textile mills which are not following good regulatory rules. You see, once The rules say that cotton dust should not be there in the environment as wherever workers are working, but cotton dust starts off even from the field where cotton is collected, and then you are cleaning the cotton and then taking it to the mill. So right from there, from the field to where it is being processed, you can have patients coming up with brucellosis. And cotton was more available in the northern belt near Ahmedabad, etc. So you have a lot of textile mills in Bombay. Ahmedabad used to have Bombay, of course. Now it's gone into the periphery, but Ahmedabad still continues to have a large number of mills, and now we have got mills all over the country. So you can have cotton dust problems in all these places. Now, what is bagasse? Bagasse is basically sugarcane dust. And this sugarcane dust, once the juice has been removed from the sugarcane, the remaining portion which is there is very useful for making cardboard and rayon, etc. So, this, if it is left, if you leave this sugarcane, once you remove the sugarcane juice, and you leave that particular bagasse, there is an because of the sugar content which is there, and because it is humid, you will have a fungal infection called the Thermoactinomyces saccharei. Now this fungus which is there, if it is inhaled, it causes breathlessness, cough, hemoptysis, and a fever. Also causes acute diffuse bronchiolitis, and this may be seen as mottling in lung fields. There's impaired lung function, and it is if treated, you can resolve it, and if untreated, it can lead to diffuse fibrosis, emphysema, and bronchiectasis. Now, as far as bagasse is concerned, you can kill the fungi by spraying with 1% propionic acid. Now, farmer's lung is another one where you find in very various fields you've got a lot of hay kept, and so when it rains, hay gets wet. Once the hay gets wet, when the sun comes again, the outside portion of the hay will dry up, but inside it remains wet, and so there is a fungus growing inside. This fungus is the Micropolyspora fani, and this fungus can cause a lot of problems. Now, once the farmer wants the hay, he takes it up and then beats it around, and when he's beating it around, he inhales, and that can cause a problem. It causes general and respiratory symptoms and physical signs, and may result sometimes, very rarely, into pulmonary fibrosis and pulmonary damage and pulmonary length. So farmer's lung is another place where you can have problems occurring. So what do you do? How can you control it? You can control it, any dust, like for example, we're talking about coal dust or silica or asbestos even, you should ensure that it is done in an enclosed process. And if you can't do it in an enclosed process, make sure there's an exhaust ventilation or a local exhaust ventilation so that the dust can be taken away. Also, you can ensure that amount of water in the environment, humidity increases. As the humidity increases, the dust will get laden with water and will settle down. Okay. Now, personal protection like masks and respirators are very important. Masks normally, and respirators if the content is so high. You must ensure initial medical examination, do a pulmonary function test for any worker coming into the industry, and carry out a periodic medical examination. Bagasse control, which is there, is basically what you can do is stop moisture in the bagasse, or you can get it sprayed with 2% propionic acid. Yes, that's all that I have for you today. Please study pneumoconiosis, very important that you, from the examination point of view. So please do that, and We'll see you next Monday with another lecture on occupational health.